It's HIMSS 2019 here from Orlando, Florida, as this is CommonWell TV. Scott Adams here with you as we're introducing you to some of our CommonWell Health Alliance members. As time now to hear from Clinical Architecture as their VP of Clinical Informatics, Dr. Victor Lee. And Dr. Lee, how has healthcare IT really developed since you guys have been able to join with CommonWell, and how do you see that evolving over the next several years?
Yeah, I think there have been a couple of significant changes since we've joined CommonWell. I think the first is with just the evolution of standards. I think standards have matured quite a bit in the last couple of years since we've joined CommonWell. There are many good folks working on things like FHIR, for example, and version 4 just came out of FHIR, and Clinical Architecture has been doing a lot of interesting things with FHIR, as well as a Smart on FHIR standard. And we've been playing around with Smart on FHIR as well. Lots of interesting things going on with other standards in HL7. We've also seen really mainstream adoption of other standards like CQL. We've seen also CommonWell connect with care quality, so that's very interesting. And I think so lots of maturation in the standards industry. I would also say the second major thing is that we're really starting to see some real-world implementation of these standards. And so standards by themselves, while they're great, I think become a lot better when we start using them and seeing what works and what doesn't work. And I think we're getting a lot more maturity from an implementation perspective as well.
Maybe a quick example of some of those real-world examples?
So for example, we're starting to see a lot of app stores for Smart on FHIR. Clinical Architecture has in fact created a couple of Smart on FHIR apps, and so we're leveraging the fact that the standards community has done a lot of work, and we're leveraging those technologies to make scalable applications that can be built once and then deployed many times across different systems.
Why is interoperability so pivotal for Clinical Architecture and what you guys do?
Well, the way I see interoperability being so important is because it's foundational to value-based care. And I know that can be a cliche and it can mean different things to other people, but when you think about what it takes to achieve value-based care, it really requires that providers are able to share information with each other. Information about patients needs to be shared across not just providers, but venues of care and across different systems, both health systems as well as electronic information systems. And in order to do that, we have to have the ability to share data. So without interoperability, we really can't lay that foundation for value-based care. So that's something that is really central to our mission at Clinical Architecture as well, and I think it aligns very well with what CommonWell is trying to achieve.
Tons of changes, advancements in interoperability. Where do you see CommonWell fitting into those advancements and changes, and how can Clinical Architecture assist maybe in those as we move forward?
Yeah, great question. I mean, I think one of the reasons why we're really excited about being CommonWell members is because that's where the action occurs. This is where the rubber meets the road, right? So you have specifications by themselves, but it's really when people start getting very specific about use cases. We might engage in discussions about interoperability in general, but there isn't such a thing as just a blanket interoperability discussion. We really need to start getting specific about interoperability for what. And so when you look at what CommonWell is doing with its use cases, we're getting very granular about things like, what are we trying to be interoperable for? We are trying to, for example, identify patients, record location, patient identification, document query and retrieval. So we're getting very specific. Again, this is where the rubber meets the road. The CommonWell members are agreeing to try to share information along the lines of these specifications, and that's how we're pushing things forward. And your second question about how Clinical Architecture might fit in is that one of our focus areas is along the lines of semantic interoperability, and this is an area where we think we can help with the entire interoperability picture.
There's been a lot of obstacles over the past 6 years in terms of CommonWell growing this alliance. Where do you see maybe the biggest challenge here as we move forward with the growth of having more organizations come on board for the one common good?
Yeah, great question. So I think One of the challenges that we face is really around the last thing I mentioned around semantic interoperability. I kind of see it as one of the last mile problems because we've done a lot of great work on around structure, around the syntax of what we're trying to exchange. So for example, I mentioned FHIR earlier, and so that's something that's gotten a lot of traction in the industry, but it's an information model, a container for data. One of the things that I think is the last mile problem is what kind of information is flowing through that information structure. And if we don't get very specific around what kinds of codes and the meaning of the codes that we're sending through those structures, then we're not going to have a meaningful exchange of information despite being able to share information. Can we make use of it? Can we understand it? Can we analyze it and gain insights from it? And this is where we think we have a very nice fit with CommonWell because we can round out the equation.
A valuable member of our CommonWell Alliance. As for more here on clinical architecture, we invite you to log on to commonwellalliance.org. Thanks so much.
Thank you.